We are back for another One Girl Revolution Conversations. Today we're featuring Katie Hardy, founder of 6 Feet Over and Suck It Suicide. We talk about COVID-19 and the struggles that all of us are facing and how we can support one another, our family, our friends, and others in our community. So you're not going to want to miss this conversation. Katie Hardy is amazing. Suck It Suicide and 6 Feet Over are doing great work, and I can't wait to share this conversation with you. We are going live with Katie Hardy from Suck It Suicide. I'm so excited to have her on. So I'm just going to give her a minute to join, and then we're going to have an awesome conversation. I'm really excited to have Katie Hardy on. Up here she is.
Hi.
Katie, how are you?
I'm good. How are you doing?
I'm doing great. Thank you. I'm so excited to have you on and to talk to you more about your great work that you're doing. How was yesterday? Yes, for those who are watching, they may know if they follow you, they may know that you were out collecting bottles and cans yesterday. How'd that go?
Pretty good. It was a slow day, I think, and it was still overwhelming, and we had a crap ton of support, so that was rad. And all
That's
my friends
awesome.
dropped by with masks and windows up and just waving. It was nice.
Oh, that's awesome. Yeah, I saw some of the pictures that you guys had, and it looked like you had a bunch of support, which was great.
I'm not going to complain about it. It was pretty damn amazing.
Yeah.
And
People
we've
are
got
so
8
people are
more.
so supportive, and people are doing such good work right now. I know it's so hard for everybody. There's so many difficult things going on, of course,
Hmm.
but there's so much good stuff happening. And obviously, you and I both love the city of Detroit and the people of Detroit. And I feel like they're like just coming out of the woodwork to support good people and support good causes.
Oh yeah, we're super duper lucky because we've got a lot of really great supporters and people who are just dope. It's great. Like, I'm not going to complain at all. I love the people who love us. I love the people who don't love us, but I love the people who love us more.
That's a good perspective to have because no matter what you're doing, you're always going to have some haters out there. But when you're doing good things, you're always going to get some negative people out there too. But
It happens. But
yeah,
most people, it's not that they hate us. They just don't know we exist yet.
right, right. Or they don't understand it too. I think sometimes people like they see you doing something, but they don't really, especially if they don't have like a personal experience with something, they kind of just make a judgment call, and they're like, oh yeah, I don't support that or whatever.
Yeah, we do have some folks that drop by when we have done outreach. I mean, right now is a time where we're not doing any real outreach, but in the past, people have popped by and made their thoughts on suicide and whatnot very clear. And
Interesting. And
it
yeah,
is interesting.
I'm sure you get a lot of interest. You have a lot of interesting conversations too with people because of course they're like, yeah, it's an intricate topic, and people
Hmm.
that have personal experiences. I know you and I both had emailed back and forth a little bit, and one thing I haven't really shared a lot publicly, but my grandfather committed suicide when I was 15. And so it's been an issue that's been very personal to me. And when I kept coming across your story, I was like, oh my gosh, I got to reach out to Katie because I just think it's so important to have these conversations and have these conversations in the public sphere, so we can better prevent suicide and also be there for people, and just spread awareness because I think a lot of people don't really understand it. And a lot of people right now in particular, but I think always, people are suffering in silence a lot of times. And you see that a lot with regards to suicide where people had been suffering for a long time, and people, they didn't feel like they had the support that they needed.
Yeah, and I think that we oftentimes we try to. There's a couple of things here. Like, suicide prevention is a really great like hashtag, and it is something that we use. But I think that we need to focus a little bit more on not suicide prevention, but focusing on what gets people to the point where they feel like that is the option for them. And then also respecting that that is legit how they feel, and knowing that there's the systems that aren't in place and that's why they might be feeling that way. We also don't train the communities like we do with breast cancer, heart attacks, or anything else to recognize the signs and be supportive.
Yeah.
So there's huge systemic issues in it, and I don't think, like, prevention is a great word for it, but I think honestly we need to be like, we need to be supportive of life
Hmm. Yeah.
as opposed to preventing somebody's death.
Totally. Yeah. And being like, I think it's building community around people because a lot of times people feel isolated. And right now, especially with everything going on with COVID, I've been very mindful of my friends who live alone or people, elderly
Hmm.
people that might feel very isolated right now. Because in my own personal experience with suicide in my family, that was an issue. My
Yeah.
grandfather felt very isolated. And even though we were there for him, he still was kind of living his life in a certain way and felt very isolated. But Katie, I want to talk about all the work that you're doing. But before
Okay.
that, I'd love to kind of give people that are watching, people that are following this, a little bit of background about you, because you have your own personal story and how you ended up kind of getting involved in this and starting Second Suicide and 6 Feet Over. So, would you mind sharing a little bit just about your own life and your own story?
Yeah, it's totally fascinating. I should write a book. I should not. But my mom died by suicide when I was 20 and my brother was 21 at the time. So we were both like super duper young. We had grown up and dealt with living with and loving somebody who had severe mental health concerns and suicidal ideologies. We didn't really, I mean, we knew it was weird and it was awful a lot of the times, but we didn't know that that was unusual. So that's a whole different thing. But when my mom died, I was 20 and it was the early 2000s. There wasn't as much support and there wasn't as much conversation around suicide then, and it was the beginning and part of the catalyst for what would come later. So me not being told that there was a name for what I was, which was a suicide loss survivor. It's not a casserole death, so as soon as the funeral was over and the sideshow was over, everybody left us.
Mm.
And that shouldn't really happen with any young adult who's put in that situation. And that's what happened to my brother and I. And then there was just a lot of little things that happened. I tried one support group, but there wasn't anybody there like me. There were, middle class to upper middle class people who the only thing that we had in common was that we lost somebody to suicide. Not even like nobody else in the group had lost a parent. I was a hardcore drinking, smoking, swearing punk rocker, and I had nothing in common with them. So I just didn't feel comfortable. I never went back. So the one opportunity that there was to have support within that, it didn't work for me. So later on, I think when I started Suck It Suicide accidentally, um, I had lost 5 more people at that point. So I was up to 6 people lost by suicide.
Mm.
And I started realizing that the people in my own community weren't talking about it and we weren't giving each other the right support and we didn't have the information and we were having to raise money for each other's funerals. So that then led to forming the nonprofit 6 Feet Over, which would give us a broader umbrella than having something called Suck It Suicide, which works well when we're doing outreach and it's rad and people really like dig it. But overall, it's a better idea to have something that's slightly more mainstream
Yeah.
for your nonprofit. And the idea behind it is that the majority of our fundraising and outreach is done by Suck It Suicide. And then we take the money that we get from merch sales and direct donations, and we help families directly after a loss to suicide. And we help pay for the things that normally you would have a fundraiser for. And so we're talking funerals, biohazard cleanup, unpaid time off of work, anything having to do with the loss. And then on top of that, we do a concierge resource service. So beyond the financial help that we're going to give them immediately after the loss, we want to know, are you going to need job training because you were a stay-at-home parent, you haven't worked for a really long time, or you didn't have a skill or a trade before? Are you going to need job placement? Are you going to need insurance now? What kind of childcare are you going to need? All of these other things. Are there food or housing insecurities? We want to make sure that they are set up. So going forward, they aren't just dropped off a cliff again.
Yeah.
And by
That's
taking care of all of these things, you're just checking off all of these risk factors that could possibly create a person who has suicidal thoughts and suicidal ideations later on. So
right.
we're lowering the risk factor for those individuals in those communities by doing all of these things.
That's so incredible. Like it's so important for us to be having this conversation too, because we need to people need to know that there are resources out there like this. And
Hmm.
really what you've created is this community. And that's what I was so touched by as I was like looking through different things you guys have going on. It's like this community that's very open and talking about, you know, what you're doing and doing outreach, and Suck It Suicide is really cool and edgy. And I'm sure that you have a lot of great conversations with people when you're doing outreach, but then also having this nonprofit that you can support people throughout their losses.
Yeah, I mean, I like talking to people. I like just the questions and conversations that we have, hearing people's stories and giving them an opportunity to just tell somebody what they've been through. Have loved ones ask questions about what they can do to help the people around them because they don't know what to ask or how to search online because there's terminology that people aren't familiar with.
Mm-hmm.
Resources are oddly named usually, or they have very specific qualifications to them. So just being able to help people get to those or understand them or give some advice or whatever, like that's what we want to do.
Yeah. So you said that it had just kind of happened by accident. Was it like through
Yeah.
social media? Like how did it start, and like how has it evolved?
So one of the things that I did used to do that was fairly mainstream in the suicide prevention-y thing, I did a yearly walk for another very large suicide prevention nonprofit. And every year I raised a little bit of money, like $100. And I would normally go walk by myself. Occasionally, like my sister-in-law or a couple of my cousins might join me, but usually I went by myself. And this one year I was like, I'm going to raise, can I swear? Just
Yeah,
asking.
totally.
Okay, because I'm a sailor. So I
Nobody
was
cares on
like,
here. I don't think anyone cares.
I was like, I'm going to raise a shit ton of money just to
Yeah.
do it.
Yeah.
And then, so I put on a show. Like I put together a show and I had a bunch of bands and we had a ridiculous raffle. And my husband had told me to buy like 30 shirts. And I was like, no, we're going to sell so many more than that. And I bought like 100. So I had 70 extra shirts left over. He's a brilliant man. And because of that, I had some friends who were really supportive of me and wanted me to make that money back because otherwise I wouldn't have anything to donate. And so I was setting up at like DIY punk rock shows and backyards in Detroit, and it just was weird. I was the girl who was talking about suicide all the time. And then we had another friend die. His name was Jason. And
Mm.
when Jason died in November of 2012, I think something clicked for a lot of my closer friends. And they started realizing that this is something that we needed to talk about. And I had more people getting a hold of me and more support. And then Facebook page grew a little bit. And then I got support from outside people like our now president, Amelia Leto, who I did not know. And she reached out to me and was like, this is rad. You swear and stuff. And I was like, yeah, fuck yeah, I
You're
do.
normal.
Yeah, I'm like, I'm doing a thing, I guess. Okay. I don't know. And it just, with the support of the community and the support of other people who actually knew what the fuck they were talking about, I was like, oh, I can do a thing and this will be really cool and I think it'll be helpful. And it's something that I needed when my mom died and when the next person 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 died. So, I'm hoping that we've had some sort of an effect on the community to where we haven't lost somebody because somebody else knew just to sit with that person quietly, or somebody knew that they could ask that person if they were thinking about it and give that person that cue, that permission to tell them about the pain that they're going through.
Mm.
So, and not just be like, hey man, let's go get drunk
Right.
or fucking do it. Like
Mm-hmm.
I'm hoping that we've had that kind of impact, but
I'm sure you have. And I think it's hard, especially when you're doing this type of work, and you could talk about a lot of different topics or a lot of different issues that people are active in. It's hard because you don't often see the fruits of what you're doing. But I
mm,
truly believe that, like, at some point, there are so many stories. More, you know, you hear once in a while, you probably have heard some stories of people who have benefited from the work that you're doing, or even just people in your own kind of circle that are like, oh, this is how Suck It Suicide has helped me, or you know,
yeah.
I was able to have this conversation with a friend. But we don't often see the fruits of what we're doing. But
And I'm totally okay with that.
yeah,
Like, if I hear one person at the end of my life and they're like, you did a thing and you helped me, I'll be like, all right, I'm good. I'm out.
Yeah. Yeah. Well, it's normalizing the conversations too, because I think that it's so important for us to be even having this conversation, because people need to know. It's unfortunately, suicide is so prevalent in our communities, and even people that think like, oh, I have no personal connection to suicide. I feel like most people do, whether they know it or not, or they will at some point, or they'll have an experience like you're talking about where a friend is suffering or a family member, and they'll be able to be there for them. So it's really
Yeah,
important for us to be having these conversations.
I agree. I agree.
So how has COVID, because you obviously have been active for many years doing activism, and supporting people, how has COVID kind of affected the work that you're doing, or how has it changed, or maybe how has it changed the dialogue or what you're seeing with regards to suicide?
So, okay, professionally and throughout what we call the suicidology field, um, it is yet to be seen. Like, we don't even usually, the numbers for the previous year come out around June, so
Okay.
we don't have numbers yet for even 2019.
Mm-hmm.
So we're not quite sure. There are some projection models that include all deaths of despair that are not looking great, but it is the isolation, it's the fear, it's financial concerns. There's a lot of different things that would be considered risk factors just on a normal day. And then when you add in a pandemic, it's going to be an issue. So we don't know. Like, you may hear about more suicides, but we're not sure yet if it is just because we're spending more time on social media, or we don't know what it is yet.
Yeah.
Um, it is yet to be seen. My hope is that it doesn't go up and
Yeah.
then it doesn't have as large of an impact as it could, but we don't know yet,
Mm-hmm.
and that's somewhat terrifying to me. But
Yeah. Yeah, because I was thinking about it when you and I were emailing. I was like, you could see on the one hand where people might feel more supported than ever, because even I myself, I feel like I've had more phone calls with friends or more Zoom calls or people checking in. But then at the same time, people might feel more isolated. And I think
yeah,
it's kind of a double-edged sword. Like, I think all of us are feeling very isolated on some days, and then other days we're feeling like we're talking to more people than we ever have.
yeah, exactly. I can't really speak to what will happen or what the numbers will even be, because I don't even know what last year's numbers were.
Yeah.
But I feel like it's a really great opportunity that people have right now to at least explore, especially if people have the extra time right now. Some people are, I mean, working crazy hours and working from home crazy hours, and not everybody has all this extra time. But if you do, it might be worth, doing some reading or doing an online training, or there's a lot of different options. And people take first aid classes and never have to give anybody the Heimlich. So you could take mental health first aid or QPR or an assist class. Some of them are being offered online now, and those will give you crisis management skills, and they are basically the same thing. You might never have to
Mhm.
use it, but it might be a good idea.
Yeah, yeah. I'll have to get some of those resources from you, because I know that people in this community would love to follow more and learn more about it. And I think
Mhm.
you said it's really important during this time to utilize this time, and even if it's like going through trainings or using this time to really check in on people and make sure that they're doing okay. Because I think everybody is dealing with this trauma, dealing with this pandemic in a lot of different ways, and even children. I mean, one story I wanted to bring up to you, and again, I know there's a lot of intricacies with regards to suicide, but one story that kind of caught my eye a couple weeks ago was a father who was sharing about, I think it was in Ohio, had shared about his son, and he was like,
Yeah.
COVID took my son, and his son had committed suicide. And that
Hmm.
was so heartbreaking to me. But even for kids, for children, we need to be, making sure that kids, whatever they're going through during this time and during like all the chapters of their lives, because it's not just during a pandemic, we're dealing with suicide. And I don't know, you probably have a lot of insight into what the causes of that are, whether it's social media or other things, but we need to make sure that even children, that kids are feeling supported and that they
Hmm.
feel like they have a community during this time.
Yeah, I think for kids, we need to remember that their brains are a pile of mush, really. I mean, our brains are dumb.
Right.
Our frontal lobe is not developed anywhere close to it until at least 23. So you're expecting somebody who learned to walk like 5 years ago to be able to reconcile a global pandemic, a
Mm-hmm.
complete change of all of their routines. Uh, everything that they have ever known has changed in the past 2 months. It's it's a lot more than what we adults, I think, recognize a lot of the times.
Mm-hmm.
We're trying to take care of our own stuff and we're trying to figure this out, but we often forget like kids are really, really resilient and they're awesome in a lot of ways, but they're also mush brains and we need to help them through this. I don't think that anybody is to blame when there's any suicide.
I agree.
That being said, I think that there's a lot of opportunity for a lot of people to help our kids out, not just the parents, extended family too. It's a thing. But yeah, it's going to affect kids, and we need to keep an eye on everybody,
Mm-hmm.
not just the adults.
Yeah. Well, you think about like how even all of us, like I feel like this pandemic is so difficult for all of us to process because we've never
Hmm.
been through something like this before. And if it's hard for us to process, I can only imagine what kids are going through. And some kids, it's cute to see like even some of my little cousins, like they don't even know what's going on. They're just like
Yeah.
happy, they get to play, everybody's home. Same with like pets, pets are happy because everybody's home. But then you have a
Hmm.
lot of children that like thrive off of socialization, and even all of us, like even the most
Yeah.
the most insular people that I know, they're still like, all I want to do is like hug somebody. I'm not even a hugger, but I
Yeah.
just want to like see
Yeah.
somebody. So it's so important for us to just keep tabs on how everybody is doing and
Yeah.
make sure that people feel, whether they're kids or adults or whatever age they are, that they just feel that we're there for them, that they have community.
Yeah. Yes, that.
So
I have an 11-year-old and he's like, I think we got a month into it and he was like, I just miss going to school. I miss my
right.
teacher. And I'm like, who are you? All
Yeah.
right, cool.
I
Like,
think that's like
I'm
the funny
sorry you can't go to school. It was just
right.
strange. I mean, it's cool, but
Yeah.
also,
It's funny how that happened. I feel like that kids are like all of us. Like the first couple weeks, they were like, "Awesome! It's like summer vacation," and now they're like, can I just go back to school? I just want to like
hmm
go back in my class." And that's all of us. Is like it was like fun for the first week or two, and then it's like, "All right, can I just go back and be real?"
yeah.
But anyways, Katie, what can people do? I know we talked a little bit, but like, what can people do in their own lives right now to support people, to look for signs with regards to suicide and mental health? What kind of advice would you give to people who are watching right now?
So social media is a really big thing. A lot of people are spending even more time on it now than ever, and I think it's really it's a bigger platform for people to express the pain that they might be going through or the isolation they might be going through a lot more so now than ever, but it is a great place to recognize if somebody is struggling. So keep an eye on your friends and family that way with what they're posting. So if they are posting about being lonely or not being able to get out of bed or having a lot of fear, all of these things that are super emotional and understandable, you should still reach out to them if you can. If you're really, really concerned about somebody, there's other options out there. I would say your first option should not be to call the cops. Just, it's not the best option.
Mm-hmm.
That's a last resort. So if you or somebody close to the family or somebody who lives with that person can check on them and talk to them, do a group Zoom where you just listen to that person, do a one-on-one FaceTime and just let that person let it out
Mm-hmm.
and give them agency. So if somebody is struggling, they already feel like they don't have control over things. Give them the opportunity to have that control. But on the other hand, they may not be able to form the right plans or to even form a plan.
Mm-hmm.
So your brain is functioning at a higher level. Give them some options. How would it be if, say, somebody can't get out of bed and they're just really, really down? How would it be if today you got out of bed and you brushed your teeth and got back into bed? That's it. And if they're like, I can do that. Okay, well, do you think that you might be able to take a shower too? You know, give them the little options. If somebody is like saying, I want to die today, and you freak out because you're like, I don't know what the fuck to say to that because you're
Yeah.
not trained in anything, you can offer to like three-way a crisis line. That's a totally acceptable thing. And that's okay. And the crisis lines are not going to be like, oh, this person's thinking about suicide, I'm going to call the cops. Their job is to talk somebody through what they're going through and listen and come up with those options. That's their job, not to get somebody thrown into a hospital.
Mm-hmm.
So it's helpful when somebody feels like somebody's with them doing it, because it is terrifying for some people just to call these lines themselves.
Right.
And if somebody says, I'm struggling, I'm in a lot of pain, I want to die, and you're just like, call a crisis line, you're just kind of copping out sometimes a little bit, when you could be like, tell me about what's going on, I'll listen. And that could just be enough for them.
Mm-hmm.
So there are options out there, but really taking a look at the social media aspect and keeping an eye on your friends from a distance that way, and just reaching out when you can.
Mm-hmm.
And if somebody is not responding to you and you've seen this several times, or you're really worried about them, bug the shit out of them. I have texted people and been like, I will drive to your house right now if you don't answer the phone when I call you in 1 minute.
Yeah.
And I swear to God, they answer their phone every time. Because I'm like, I will drive to your house. I will stand outside of your house. I will bring a radio with me. I'll play songs. I will embarrass the shit out of you. Like, you need to answer your phone because I'm going to be there for you. I'm going to force you to talk about this. And even if you just answer the phone and you say, I will call you back tomorrow, I'm okay, I don't have a plan, I'm not going to die today, that's good enough for me.
Mm-hmm.
And then if you don't call me tomorrow, same shit. Like, until we have this figured out, I am going to overly support you and make sure that I do everything I can to help you.
Because it's like that split second. It's like people just need someone to be there with them. And even there was a documentary, I haven't seen it, but I've read about it, the documentary about the bridge, the Golden Gate Bridge in San Francisco, and jumpers, and all the stories, like some of the people who have survived, and how they talked about like different people were like waiting for they were walking or getting on the bus to go to the bridge to jump off and commit suicide. And they were like, all along I was waiting for one person to smile at me. Or I was just looking for one person to call me, or whatever, like all these like split second things. And then the people that shared their stories, that those split second things, some of the people, those split second things happened and it changed their trajectory. They decided not to jump, or they decided like, let me give it one more day. And so I think that's what we can all do as friends and family and supporters of people, is to just like encourage them, walk with them. It's like one step at a time, and people are struggling. And a lot of people with mental health, it's a long-term journey. It's our entire lives that we're dealing with stuff. So I think
that's super important. But I do really want to point out, just because we've been talking so much about the prevention aspect, as a loss survivor and as like a new loss survivor, oftentimes people are questioning themselves. They have guilt. They blame other people. They blame circumstances. They blame a lot of things. And I think it's important to just say, sometimes people just die.
Yeah.
We can fight cancer as hard as we can. There could be a cure for cancer, but people will still die from cancer. So sometimes people just die. It's never anybody's fault. And it's okay.
Yeah.
It's not okay, but
right. But I think it's an important note, because there is also only so much we can do. We can't camp out. We can't force ourselves like into somebody's house and sit there and watch them sleep. There
are limits, and there is agency that people need to have. But sometimes people just die. Yeah. And you may not have seen it coming. Nobody could have. That just happens too.
Yeah.
I have a big issue when it comes to the risk and warning sign list, because it literally could be everything on there.
Right.
Or it could be nothing.
Right.
They could have shown no signs.
Yeah. And if you read stories about suicide, or you hear stories from different people, it's like sometimes you had no idea. And even my grandfather was like, we had no idea that would have happened. But Katie, what can people do to support your work? Like, obviously, they can follow Second Suicide, they can follow 6 Feet Over, but what can they can if they live in Detroit or anywhere in the Michigan area, they can of course give you donate cans. For those
Yes,
who are not in Michigan, we get 10 cents per can and bottle, so people can do that. So I'll be sure to like post that so people that
please
are following
do.
from Michigan and Detroit can donate. But what else can people do to support your awesome work?
Well, right now we're working on our website, so our donation portal isn't up on our website. We do have it tagged, like pinned at the top in a post on the Second Suicide and 6 Feet Over Facebook pages. There's
Cool.
a donation, like a temporary donation portal link there. Um, we are accepting checks. Uh,
What about Venmo though? Do you have a Venmo and
we
PayPal?
have Cash App.
Okay, okay. So
So
you
if people wanted to Cash App, it's money sign SFOSIS, I believe,
okay.
or vice versa. I'll have to look, but I'm on my phone currently
I'll put
right
it in
now.
the notes for this. So
Okay, cool.
yeah, so people can check it out because I know that a
Yeah.
lot of people are obviously going to want to look at your website for resources and support you. So
Yeah. I mean, if people just want to get a hold of us and ask us questions, it's info@sixfeetover.org, but it's SIXFTOVER.org.
okay.
And that goes either to myself or an intern and another board member, and one of us will get back to you and help you out. If you need help finding resources, we can totally do that. We're clearly not doing any outreach right now, so that's what we normally do. We'll do
Yeah,
it digitally. It's fine.
yeah.
And then with the bottle drive, yes, our building does look like a giant, crazy haunted prison. I swear to you, it is not. It is beautiful inside. There's just a bunch of small makers and businesses on the inside.
Is it? It's the pony ride.
Yes. So
Okay.
Pony Ride as the entity will be leaving that building, but we're staying there.
Oh, cool. Okay, awesome.
Yeah, so we're staying there, and that's Core City. I think it's Core City Inc. or LLC that own it, and they're rad. They're totally letting us use the entire like parking lot area and do all of the things that we need to do for the bottles, and then they're allowing us to store them in the basement for free. So they're doing us a huge solid. I adore them. I love them. I would hug them, but no.
6 feet apart, 6 feet apart.
Yeah.
But I'll be sure to like post all that because I know people are going to want to support you guys. And obviously, like once things start to open back up, you know, people I'm sure will want to get involved in activism and other things, and you'll be able to kind of direct people in those ways too. So I hope that everybody who's watching, whether it's here or on YouTube, that they will follow you guys because you're going to give a lot of you give a lot of great resources, but also opportunities for people to learn and do outreach and to
Yeah.
support people in their own communities.
Yeah, this summer we've got a lot of really cool ideas and plans that we're going to start putting together. I'm really excited about it. So, yay!
That's awesome. Well, and we'll have to stay in touch, Katie, because I really want to
Yeah,
have you on the podcast and we can like
cool.
talk more about. I think this is like a cool. I wanted to have you on sooner rather than later because of everything going on with COVID, but I would love to sit down, hopefully sit down with you. Otherwise, we can do it over Zoom. Who knows how all this is going to play out, but I'm
I
just
don't know.
so
This is kind of nice. I get to drink a beer and I don't have to wear
right.
shoes. So,
It's like a happy hour. It's a happy hour Instagram live. But Katie, this is what's so awesome, and you're doing such great work. But before I let you go, I just want to ask you. You know, right now is such a difficult, hard time for so many people. We're obviously all going through a lot of difficult days. But what's giving you hope right now?
oh, me? Oh,
Yeah,
geez. Wow. Okay.
personal. It's personal, but I think that it's important for us to find things. And maybe it's your bottle drive. I mean, I was so inspired
Yeah.
yesterday seeing all the people bringing out bottles and stuff, supporting you guys.
I don't know. I'm a pretty lucky person because I get to live in this world where I have people tell me all the time that they like what we do and they appreciate us and then they show up to shit. So like just yesterday having people show up to a place that they didn't know where the crap they were going and it looked spooky as fuck, like that gives me hope that people are that willing to drive their $7 worth of cans to me so I can have it.
Yeah.
And that's awesome. Like if they came with 2 cans, I'm like, yes,
Yeah.
because that adds up. And
Totally.
we totally need the money right now. So anything people are giving us, we're like, yes, thank you. Just the support that I'm seeing from a lot of people. The way that I've seen complete communities rally around frontline workers and essential workers. And I've seen more good than I've seen bad. And that's what gives me hope in general for humankind and our existence, and that we're going to be okay.
We're going to be okay. We're
We're
gonna
going to be
do
okay.
this. We're doing it. We're doing it one day at a time.
It's going to suck balls, but
right.
We're going to be okay.
That's why we got to do it together. We got to support one another and build community. But yeah, Katie, you are so awesome. I'm so happy to be connected with you. Thank you so much for your time and doing this. I will be sure to post it on YouTube, and I'll send you the link so you can share it with your people too.
Cool.
And we're going to do a podcast soon. So I will email you about that. But thank you so much for joining, Katie.
My pleasure. It was super rad. Thanks for having me in my garage.
We will talk to you soon, okay? Enjoy your beer.
Oh, I'm gonna. All right, have a good one.
Talk to you soon. Bye.